1. A client has been admitted to the hospital with findings of urinary tract infection and dehydration. The nurse determines that the client has received adequate volume replacement and has returned to normal hydration status if the blood urea nitrogen level is A. 5 mg per deciliter, B. 15 mg per deciliter circa 27 mg per deciliter, D. 34 mg per deciliter. Correct answer, B. Rationale. The average blood urea nitrogen level is 8 to 25 mg per deciliter. Values such as those in options C and D indicate continued dehydration. Option A reflects a lower than average cost, which may occur with fluid volume overload, among other conditions. 27 mg per deciliter indicates a normal BUN, showing that the client has received adequate volume replacement and has returned to normal hydration status. 2. A client newly diagnosed with diabetes mellitus has a glycosylated hemoglobin A1C level of 10%. The nurse ensures that client teaching includes which of the following? A. Avoiding infection. B. Taking in adequate fluids. Y. C. Preventing and recognizing hypoglycemia. D. Preventing and recognizing hyperglycemia. Correct answer, D. Rationale. Glycosylated hemoglobin is tested to monitor the long-term control of diabetes mellitus. It measures the amount of glucose that has become permanently bound to the red blood cells from circulating glucose. If the blood glucose level rises, the amount of glycosylation is also elevated. This indicates that the client has had periods of undetected hyperglycemia. For glycosylated hemoglobin A1C, 7% or less indicates reasonable control, 7% to 8% indicates good power, and 8% or higher indicates poor control. The test result helps the nurse identify the continued need for teaching related to the prevention of hyperglycemic episodes. Options A, B, and C are therefore incorrect, while option D is the correct answer. 3. The nurse is caring for a client who has ascites and hepatic encephalopathy. Which of the following prescriptions should the nurse anticipate from the primary healthcare provider, PHCP? Select all that apply. A. Furosemide. B. Neomycin circa naproxen. D. Lactulose. E. Diazepam. Choices B and D are correct. Neomycin is an antibiotic and is indicated for hepatic encephalopathy. This oral medication is taken to decrease ammonia's gastrointestinal production, which is contributing to encephalopathy. Lactulose is central in treating hepatic encephalopathy because it traps ammonia in the colon and increases its transit, thereby decreasing serum ammonia levels. 4. The client is admitted for having unstable angina. The nurse caring for the client understands that nitroglycerin should not be given to the client if he manifests which sign or symptom? A. Atrial fibrillation. B. A blood pressure of 78/59 of a millimeter Hg, circa headache. D. A warm flushed feeling. Correct answer, BA is incorrect. Nitroglycerin is not contraindicated in atrial fibrillation. Therefore, it is safe to administer the drug even if there is atrial fibrillation. B is correct. Nitroglycerin is a vasodilator that causes a decrease in blood pressure. The nurse should not administer any drug that causes the blood pressure to drop when the client's systolic blood pressure is below 90 mm Hg. C is incorrect. Headaches are a common side effect of nitroglycerin and should not be a reason to withhold the drug. D is incorrect. A warm flushed feeling is also a side effect of nitroglycerin, which is caused by its vasodilatory effects. 5. The nurse is caring for a client in the intensive care unit with acute respiratory failure. The nurse should expect which ABG results? A. pH 7.29, PCO 256, POW 2 to 83, HCO 322b. pH 7.38, PCO 240, POW 2 to 92, HCO 325c. pH 7.49, PCO 234, POW 2 to 96, HCO 328d. pH 7.40, PCO 2 to 65, POW 2 to 85, HCO 316. A is correct. A client in respiratory distress should be expected to exhibit acidosis, hypoxemia, and hypercapnia, respiratory acidosis, in his ABGs. Option A indicates respiratory acidosis. B is incorrect. This is indicative of a normal arterial blood gas result. C is incorrect. This is an arterial blood gas result showing respiratory alkalosis. Respiratory alkalosis commonly occurs in hyperventilation wherein more carbon dioxide is eliminated. D is incorrect. This is an example of compensated respiratory acidosis. 6. A client in his early 60s is brought to the ER complaining of shortness of breath. Initial assessment findings include crackles, finger clubbing, and dry cough. The client states that he has previously worked in construction for 15 years. The ER physician suspects asbestosis. Which nursing problem should the nurse prioritize in the client? A. Impaired gas exchange. B. Imbalanced nutrition. Less than body requirements circa fatigue. D. Ineffective airway clearance. A is correct. In asbestosis, there is filling and inflammation of lung spaces with asbestos fibers. These fibers move into the alveolar space and cause fibrosis, leading to increased production in secretions and impairing gas exchange. This should be a priority problem for the nurse. B is incorrect. There is imbalanced nutrition in the patient because of his difficulty of breathing and intolerance to activity. However, it should not be prioritized over the gas exchange. C is incorrect. Because of the client's impaired oxygenation, there is not enough oxygen that reaches the muscles to sustain activity. However, this problem must not take priority over the gas exchange. D is incorrect. Due to the increased secretions brought about by the asbestos fibers, there is an ineffective airway clearance. Although equally crucial with gas exchange, the nurse should prioritize impaired gas exchange over airway clearance because treatment for asbestosis is focused on the relief of symptoms. Oxygen delivery to the cells holds more importance. 7. A nurse is reviewing the arterial blood gas results of a client and notes the following: pH 7.45, PCO2 of 30 mmHg, Hg, and hydrogen carbonate of 22 meq. L. Which of the following conditions do these results indicate? A. Metabolic acidosis, compensated. B. Respiratory alkalosis, compensated circa metabolic alkalosis, uncompensated. D. Respiratory acidosis, uncompensated. Correct answer. B. The normal pH ranges between 7.35 to 7.45. A respiratory condition would show an inverse relationship between the PCO2 and the pH, as seen in this case. In a metabolic state, the hydrogen carbonate would have direct contact with the pH. Because the pH is at 7.45, which is within the normal range, this is an indication that compensation has occurred. Therefore, option B is the correct answer, while options A, C, and D are incorrect. 8. A middle-aged African American is being treated in the emergency room for a sickle cell crisis. Which position should the nurse place the patient in? A. Side lying with flexed knees. B. Fetal position circa semi-Fowler's position with knees and hips bent. D. Semi-Fowler's with legs extended on the bed. Correct answer. DA is incorrect. The nurse should facilitate oxygenation and adequate circulation for the client. Knee flexion impedes the flow of the client. B is incorrect. In a fetal position, the client's knees and hips are flexed. Knee and hip flexion impede circulation in the patient. The nurse should ensure that flow is optimal when positioning the client. C is incorrect. Semi-Fowler's position facilitates lung expansion, however, the bent knees and hips impede the client's circulation. The nurse should not place the client in this position. D is correct. The client in sickle cell crisis should be positioned to optimize circulation and oxygenation. The nurse should place the client in semi-Fowler's position with his extremities relaxed and straightened. 9. The nurse is providing discharge instructions to a client prescribed nasal cannula oxygen. Which of the following instructions should the nurse include? Select all that apply. A. Keep a pulse oximetry device readily available. B. Pad the tubing in areas that put pressure on the skin. C. Have a sign on your door indicating the presence of oxygen. D. I should use the oven and not the stovetop to cook. E. You may apply petroleum jelly to your nares to prevent drying. Choices A, B, and C are correct. A pulse oximetry device should be provided to the client, and they should be encouraged to log their oxygen saturations as directed. If the client experiences dyspnea or tachypnea, the client should be instructed to seek medical attention for a level less than 95%, unless otherwise directed. Padding the tubing around pressure ears, back of the ears, is recommended to avoid injury. A sign posted on the door should be visible to alert visitors of the oxygen and extinguish and open flames. Choices D and E are incorrect. Stovetop and oven cooking is highly discouraged as the presence of oxygen may accelerate any fire that may ignite. Rather, if cooking is to be done using heat or flames, another individual should do the cooking, and the oxygen should be greater than 6 feet away from the flame source. Petroleum jelly should not lubricate the nares as it may be aspirated. Water-soluble jelly is recommended. 10. During handoff, the nurse was informed that a patient's serum potassium is 2.8 MEq/L during rounds. The first thing that the nurse should assess in this client should be A. Ability to balance while walking. B. Quality of peripheral pulses circa respiratory status looking out for shallow respirations. D. Frequency of bowel movement. Correct answer is C. Rationale. Hypokalemia affects the musculoskeletal, cardiovascular, neurologic, and respiratory systems. The skeletal muscles become weak, which may make ambulation difficult. The peripheral pulses may become weak and thready. One of the muscles that will become weak is the diaphragm, which can lead to weak and shallow respirations. There may be decreased peristalsis in the GI system leading to constipation. So, all of these assessment findings are possible with hypokalemia. However, it is the respiratory system that is the first thing that the nurse should assess. Remember, airway, breathing, circulation. Hypokalemia causes weakness of the diaphragm muscle which may lead to shallow respirations and respiratory insufficiency. This is the priority, therefore respiratory status should be assessed first in any client with hypokalemia, making option C the correct answer. Options A, B, and D should also be included in the assessment but are not the utmost priority and are, therefore, incorrect. 11. The infant just finished surgery to repair a malfunctioning ventriculoperitoneal shunt. Which symptom would indicate to the nurse that a problem could be arising? A. Increased urine output. B. Depressed fontanelle circa a decreased heart rate. D. Irritability. Correct answer. DA is incorrect. Increased urine output is not related to problems with VP shunting. B is incorrect. Depressed fontanelles are a sign that the VP shunt is draining the CSF from the child's cranial cavity. A bulging fontanelle is a sign of a problem. C is incorrect. Bradycardia is not an initial sign of increased ICP. Tachycardia should be observed in increased intracranial pressure. D is correct. Irritability in an infant is a sign of increased intracranial pressure. 12. A nurse is calling the physician regarding a new medication order because the dosage prescribed is higher than the usual recommended dosage. The nurse, however, is unable to locate the physician, and the medication is due to be administered. Which action should the nurse implement first? A. Contact the unit's nursing supervisor. B. Administer the dose as prescribed since the nurse is protected by a written order. Circa hold the medication until the physician can be contacted and the order is clarified. D. Administer what the nurse knows as the recommended dose until the physician can be located. Correct answer. The correct answer is A. If the physician writes a prescription that is questionable or requires clarification, the nurse's responsibility is to contact the physician. If there is no resolution regarding the order because the physician cannot be located or because the physician insists on keeping the medicine as it was written, the nurse should contact the nurse manager or nursing supervisor for further clarification as to the proper steps that should be taken. Under no circumstances should the nurse proceed to carry out the prescription until obtaining clarification. 13. The nurse is teaching a client about newly prescribed insulin glargine. The nurse recognizes the need for further instruction when the client makes the following statement. Select all that apply. A. I will take this insulin right before my meals. B. I should roll this vial of insulin before removing it with the syringe. C. This insulin will help control my glucose for 24 hours. D. I can only inject this insulin into my abdomen. E. I'm glad to know I can mix this with my regular insulin. Choices A, B, D, and E are correct. These statements are incorrect and require follow-up. Insulin glargine is a long-acting insulin that has no peak effect. Thus, it is not taken with meals. It is dosed once a day to provide glucose control for 24 hours. Insulin glargine is not a suspension, thus, it does not need to be rolled like NPH. This insulin is not mixed with any other insulin. Insulin glargine does not have to only be injected into the abdomen. Choice C is incorrect. This statement is factual and does not require additional teaching. Insulin glargine provides basal glucose control for up to 24 hours. This, combined with a carbohydrate-controlled diet, should decrease the client's reliance on correctional insulin. 14. A client has just been transferred back to his room following a below-knee amputation of the right leg. The nurse is closely monitoring the client. Which sign would prompt the nurse to assess further as it could indicate a developing complication? A. The client is growing increasingly restless. B. The client has a blood pressure of 127/78 of a millimeter of mercury. C. The client has a pulse rate of 89 bpm. D. Hypoactive bowel sounds were found upon auscultation of 4 quadrants. Correct answer. A postoperative client who is growing increasingly restless should prompt the nurse to monitor closely and assess further as it can indicate hemorrhage, shock, or pulmonary embolism. A blood pressure of 127/78 of a millimeter of mercury is healthy as well as a pulse rate of 89 bpm. Hypoactive bowel sounds are expected postoperatively. The correct answer, therefore, is option A, while options B, C, and D are incorrect. 15. A nurse is conducting client teaching on a client receiving a monoamine oxidase inhibitor, MAOI, about his drug therapy. The client has demonstrated understanding by stating, "I should avoid tyramine-containing foods, or I may go into a hypertensive crisis." When asked to list down specific tyramine-containing foods, the client would be correct by including which of the following foods? A. Cream cheese. B. Swiss cheese circa milk. D. Ice cream. Correct answer. B. Fermented, aged, or smoked foods are high in tyramine and should be avoided. Thus, Swiss cheese. Cream cheese, milk, and ice cream are unfermented milk products and may be taken by patients on MAOIs without incident. The correct answer, therefore, is option B. Options A, C, and D are incorrect. 16. A client with thrombocytopenia is currently having epistaxis. The most appropriate nursing intervention should be A. Instruct the client to lie flat with his neck suspended. B. Ask the client to sit upright, leaning slightly forward. Circa ask the client to blow his nose, then put lateral pressure on his nose. D. Ask the client to hold his nose while bending forward from the waist. Correct answer. B. In the event of epistaxis, the client should be instructed to assume an upright position, leaning slightly forward to help prevent an increase of vascular pressure in the nose and help prevent aspiration of blood. Option B is therefore the correct answer. Lying in the supine position would predispose the client to aspiration. Blowing the nose would risk dislodging any clotting that has occurred and promote further bleeding. Bending at the waist increases the vascular pressure in the nose, which would lead to further bleeding instead of stopping it. Options A, C, and D are therefore incorrect. 17. The nurse is caring for a client with a major thermal burn. Which initial laboratory abnormalities does the nurse anticipate in response to the burn? Select all that apply. A. Hemodilution. B. Hyperkalemia circa metabolic acidosis. D. Hyperglycemia. E. Hemoconcentration. Choices B, C, D, and E are correct. Following a major burn, significant fluid and electrolyte changes occur from cellular damage, which causes potassium to leak into the extracellular space. Thus, life-threatening hyperkalemia may occur. Metabolic acidosis is likely because of the impairment the burn causes to the kidney's ability to recycle bicarbonate. The discharge of catecholamines causes glucose release from the liver, raising the blood glucose. Finally, the loss of fluid causes hemoconcentration, illustrated by an elevated hematocrit. Choice A is correct. Initially, the client with a major thermal burn will have hemoconcentration from all of the fluid loss. Hemodilution may occur later in the process from the fluid shift. 18. The client in a psychiatric clinic tells the nurse, "I want to kill my wife. The moment I see I am going to kill her." What should be the nurse's next action? A. Respect the client's right to privacy and confidentiality. B. Document the client's statements circa notify the client's psychiatrist of the comments. D. Explore the client's feelings about his wife. Correct answer. CA is incorrect. Although the nurse should respect the confidentiality of the subject, the nurse should make arrangements so that the wife is informed of the threat to her safety. B is incorrect. The nurse needs to document what the client said in the conversation. However, the nurse should implement measures to ensure the safety of the client's wife. C is correct. Mental health staff must report identifiable third parties of threats made by a person, even if these threats were discussed in a private therapy session. D is incorrect. Exploring the client's feelings regarding his wife would further increase the client's anger toward her. This is not an appropriate action for the nurse to take. 19. The primary healthcare provider prescribes 30 ml per kilogram of 0.9% saline to a client with suspected sepsis. The client weighs 236 pounds. How many ml will the nurse infuse into the client? Fill in the blank. Round your answer to the nearest whole number. Blank, ml. First, convert the pounds to kilograms by dividing the weight in pounds by 2.2. 236 divided by 2.2 equals 107.27 kilograms. Next, multiply the prescribed amount of fluid by the client's weight in kilograms. 30 milliliters times 107.27 kilograms equals 3,218.1 milliliters. Finally, round the amount of fluid to a whole number. 3,218 milliliters. 20. The nurse is assessing a client who has developed cardiac tamponade. Which of the following findings would the nurse expect to observe? Select all that apply. A. Bibasilar crackles. B. A systolic murmur circa bradycardia. D. Jugular venous distension. E. Hypotension. Choices D and E are correct. Classic manifestations of cardiac tamponade include tachycardia, tachypnea, pericardial rub, jugular venous distension, and hypotension with a narrowed pulse pressure. Choices A, B, and C are incorrect. Bibasilar crackles, a systolic murmur, and bradycardia would not be consistent with cardiac tamponade. The client with cardiac tamponade would have tachycardia to increase cardiac output, coupled with a pericardial friction rub if the tamponade is caused by inflammation. Cardiac tamponade may be caused by an array of infectious and non-infectious reasons. Immediate treatment of cardiac tamponade would be pericardiocentesis. A needle is inserted to aspirate the pericardial fluid in this ultrasound-guided procedure. The provider may elect to leave a temporary catheter in place in the pericardium to drain more fluid. Nursing care involves reporting any suspicion of cardiac tamponade promptly to the provider.